athlete Bethany Werner, now a second year obstetrics and gynecology resident at UT Southwestern Medical School.
Even through a pandemic, babies do not stop coming. Talk about your day-to-day at Parkland and how this pandemic has changed the way you treat your patients, you meet with your patients, you deal with deliveries.
I think it has completely changed the way that we have practiced on labor and delivery. So every mom coming in gets a COVID swab, whether they have symptoms or not. And then, we kind of triage from there. I've had the opportunity to deliver several COVID positive moms. So it's different. I think about this time last year, I would just have a mask on and just for the delivery, and now just anytime I go in those rooms, it's multiple layers and donning and doffing and making sure that I'm, protecting myself as well as the other moms that I take care of at other parts of the day. And then delivering them has also changed a lot too, because depending on if the mom has symptoms or not, sometimes, it depends on whether or not the baby's able to stay in the room, which has really been a challenge kind of getting to learn as well as explain to moms sometimes why we have to separate them from their baby.
You mentioned that you've had a couple positive cases on delivering mothers. How does that affect the child? Do you test the child after birth as well? And have you had newborns testing positive?
To be completely honest, with the OBGYN side, I know a lot more about our side that we do. So we test all the placentas, or we send the placentas to the pathologist to be evaluated. Our pediatric and NICU colleagues are doing a really good job of evaluating the babies and determining if they need to be isolated or, kind of next steps with that. And so to be honest, I feel like I have been, fortunate enough, I take care of the moms, so we have really good colleagues that care for the babies and are kind of the experts in doing all of that stuff.
It definitely sounds like a team situation you guys have there. That's got to be something you, as a former student athlete, are familiar with, playing with the volleyball team for years here at UT Dallas. Talk about your years as a student athlete and how you rely on that experience as a team member to battle through something like COVID-19.
So I think, as a student athlete, you have to realize, especially in order to be really successful as a team, that it relies on, multiple team members contributing together, everyone else doing their job, you doing your job to be successful. And, with the COVID pandemic, I think it's the ultimate team effort. There's everyone from our environmental services team who cleans the rooms of COVID positive patients, to sonographers, to any radiology technicians who are taking chest x-rays, to our nursing staff who, they're the ones checking vital signs on these patients and letting us know if they look sicker, obviously to resident physicians like myself who are delivering them and, seeing them postpartum and things like that, and our attendings too who are seeing all these patients as well. I would not feel as safe, and I feel like the care that we're providing to these women who are COVID positive, the reason why I feel safe and why I feel like they're getting the care that they deserve is because everyone is doing their job, and we have a really great team who's taking care of everyone.
Is there something you could share with us, maybe you've experienced that emotionally has hit you hard, and maybe you can explain to the audience that's watching us right now the seriousness of this pandemic?
I think when you're working with the vulnerable population at Parkland that I see day in and day out, and when they hear that they have this diagnosis, or especially if they're coming in really sick, hearing some of these social situations that some of these women are in. Every patient who comes back positive, we ask them certain questions just to make sure that we have a full history. Who are you living with? Do they work? Do you work? Who's been leaving the house? And it's not to make any of those people feel bad per se. It's more of just so we understand. It's almost gut-wrenching because it's like, of course they got the coronavirus because there's, a lot of people crammed into one small apartment and a lot of their family members are having to work. And so I think, it's one of those things like these moms, it's very gut-wrenching for them to hear that they have it, realize that their delivery, maybe, who can be in the room and things like that has all changed because of the COVID positive status. There's ample evidence that has shown that people who come from poor communities have higher infectivity rates, and obviously which can lead to poorer outcomes. And so I think that's been really hard, is just knowing that it's sometimes these women come in and have it, and they were doing the best they could. They were wearing a mask, they weren't really going anywhere, and then they still managed to get it. And I think that's been hard to see sometimes.